You've been sending in your questions on the coronavirus vaccine, and here to answer them is Dr. Bharat Pankhania from the University of Essex, Exeter Medical School, and Professor Stephen Evans from the London School of Hygiene and Tropical Medicine. Welcome to you both, and we're delighted you're here because we've had a lot of questions, so let's get straight to it. And Dr. Pankhania, I'm going to start with you. This is a question from Aaron George, who is in Leeds. Why should I have the vaccine if I'm not worried about COVID, and indeed if other people are having the vaccine?
Well, Aaron, the point of having the vaccine is it provides protection for you. But if it doesn't provide protection for you because you don't want to have the vaccine, remember, you could become a case. And if you are a case, you may infect people who are your family members, your relatives, your friends, and other people. And therefore, it is better to protect yourself. This is very important because you don't know what your situation will be like in 2, 3, 4, 5 years' time. But protection is always good. And also, you can feel assured that you're not going to get infected and not going to infect other people. That's the important bit.
OK, Professor Evans, a question from Anne Koerman in Nottingham. As Dr. Pankhania was saying, the vaccine provides protection, but Anne wants to know, would being vaccinated ensure that you cannot transmit the disease to other people?
Thank you very much. Really good question, Anne. When we say ensure, the answer is no. Reduce the likelihood. The answer is almost undoubtedly yes. It's very difficult to measure the transmission to other people, and so the best we can do is measure the virus levels in those who've been vaccinated. And in the Pfizer trials, they've only measured the virus levels in those who have symptoms. In the Oxford AstraZeneca trial, which has been published in The Lancet, they measured asymptomatic people, and it was clear there was reduction in the virus level in those who are asymptomatic. So the answer is it will reduce the transmission, but it won't make it zero. So it doesn't mean we can get rid of the distancing and masks, even if people have been vaccinated ourselves and those around us.
Very interesting. Dr. Pankhania, Andy Sir from Sheffield wants to know, is it safe to have the vaccine if you have epilepsy? So a very specific question there.
I think so. My answer to Andy is there is no reason why that vaccine, the mRNA one that has been licensed, will in any way interfere with either his epilepsy medication or his epilepsy. So talking empirically, I would say yes, it's always better when you're having the vaccines to have this conversation at that point as well.
OK. Professor Evans, Richard wants to know how safe the vaccine is. I know this is a question that is occupying the minds of a lot of people because he says the MHRA appeared to miss a very obvious exception for taking the vaccine. And he asks what else might have been missed.
So again, a really good question, Richard. I don't know that it is certain that the MHRA missed this.
We ought to say what it is, Professor Evans. Can you just explain?
What it is that allergic reactions have occurred in 2 healthcare workers, as we understand it, who had a history of having very severe allergic reactions. Now, the information given to professionals and patients was that those with hypersensitivity to any of the constituents should not be given the vaccine. Now, in some senses, that isn't very helpful because people don't know whether they're hypersensitive to that. And so you could argue that the MHRA failed to warn that people who have had a history of really severe allergic reactions should avoid the vaccine. But we didn't know that beforehand. And that's why it's really important that we continue to monitor the safety of this vaccine once it's out there in the real world. We do the best we can in trials, but there will be people who were not in the trials who we will vaccinate because we want to protect them. And it means that there will be things Most of them will be coincidence rather than actually caused by the vaccine, but there will be some things that could be caused by the vaccine that we don't know about because they're rare. So we have to monitor it. And in the UK, we're doing a phenomenal job that the records of people who are vaccinated are getting back into the GP records, and we're going to be able to follow them up. So when we say, is it safe? Well, how many healthcare workers have died as a result of COVID? Really sad for the two people who have had these nasty reactions, but they were prepared for it. And it's part of the reason why you have to wait 15 minutes or so after getting the vaccine to ensure you're doing okay. All vaccines, you are warned whenever you give an injection to be careful about these kind of allergic reactions, but they occur rapidly and there is help on hand to be able to deal with the consequences. So yes, I think that the balance of benefit to harm is very clearly still favorable. It's annoying in some senses for the world of euphoria that these things have happened, but at the same time, it's good that we've learnt about them, it isn't hidden away, and we know how to advise people to delay at least until we know the cause of these allergic reactions.
And
Thank
it's
you.
worth saying, of course, that the MHRA is the regulatory authority. Now, Dr. Pankania, a question from Richard Griffiths in Walsall, and this is an interesting question. If a person is vaccinated whilst they've got the virus, could the autoimmune response be affected?
Well, we have no evidence that that is the case. So what Richard is asking is, will the immunization then give me extra trouble with my autoimmune system acting against my other organs? We have no evidence for this. And this is another reason why when we give the vaccines, the dose is very carefully titrated, meaning the right amount to induce the right amount of immunity without hyperstimulating your immune system. So whilst there is no evidence that it happens, we are still very cautious and careful about giving the right dose only to create immunity and an immune response.
Professor Evans, Susan Kavanagh from Gillingham wants to know how scientists know that the COVID-19 vaccine will not interact badly, or perhaps actually even more pertinently, reduce the effectiveness of other medications that a person might be taking.
Very good question again, thank you. We do not know for certain that this will be so. However, our previous experience with vaccines and our knowledge about how they work suggests that any possible interaction with ordinary medicines that you take will be almost entirely absent or probably entirely absent. When you get interactions with drugs, don't forget the drugs are being taken day after day after day, and the effect of two different drugs can be that they interact. With a vaccine, you're given it twice, and the effects in terms of something on the drug is short term. What is happening is that the vaccine is training your immune system to itself respond to the incoming virus when you are exposed to it. And so you train your immune system to be able to fight off that virus. And that training is a rather different process to the ones that we have for drugs. Now, it's possible that some drugs that affect the immune system, so-called immunosuppressants, may end up giving a reduced response for the vaccine. And that is certainly a possibility, and there are warnings that that could be so. And so, unfortunately, the people who have immunocompromised systems who may be at risk may also have reduced efficacy for this vaccine.
Dr. Pankania, Deborah Hobbs from London, she has a simple question. Do blood types make a difference to the taking of the vaccine?
Again, in answer to Deborah, the answer is no. There is no evidence that one blood type performs better than the other. My answer to all people who are worried about this is to say, look, the vaccine has been shown to be effective in a wide range of groups and people, and there is no reason to think that one blood group performs better than the other.
Unfortunately, gentlemen, we've run out of time, which is a real shame because we've got a lot of other really good questions, but we got through quite a lot, and I'm very grateful to you, Dr. Bharat Pankania from the University of Exeter Medical School, and Professor Stephen Evans from the London School of Hygiene and Tropical Medicine. Always good to have you join us on BBC News. Thank you.
Thank you.
Thank you very much.